requirements of dependent population. You are telling that the elderly population are the dependent population. Old age dependency ratio, there is a ratio. What is this ratio? Total aged 60 divided by the population age 15 to 60. This is the parameter. What is the age dependency ratio? But the basic tenet of this age dependency, I would not like to recall you that old age should be called as a dependent age. It must not be dependent. It should break the cycles of dependence. Every old age, every elderly person should be independent and autonomous, and this is the basic motto of the old age organization. Now in Japan, this ratio is 42, but is expected to jump to 66 in 2050. Now this in society, the role of Swamiji is getting more and more importance. Just because of this factor, this slide, I think you have to ponder over this one. Urbanization, migration of young people, small families. What is there? You must be encountering many families in your vicinity. It is a normal day-to-day affair. Your children are well settled. Your children are very, very matured enough. They have gone to IITs, they have gone to MITs, they have gone to America, or they have been doctors, they have gone to London. All your children are outside. There is nuclear family, no joint family. You and your wife at the age of 70 are living together. Nobody is just going to take after you, take care of you. I think in that lonely surroundings, you feel extra lonely. And at that time, you can need the help of Dr. Samantral, the psychiatrist living here. And this psychiatric situation, particularly migration of young people, leaving the older people, or you can say the elderly people in the home, and the children enjoying in the distant areas. This is a very dismal scenario, particularly for the elderly people. Previously, when there was not nuclear families, joint families were allowed, where the grandfather used to teach Ramayana to their granddaughters, grandsons, Ramayana, Gita, all sorts of sanskars and cultures. This is absent nowadays in our society. No grandfather is going to teach their grandson, granddaughter like this. So the lack of culture, and that lack of culture, the lack of proper culture, is not teaching the youngsters to pay proper regard to the elderly people. We were considered, we have thought in the rural area previously about 50 years, 20 years back, to give proper utmost respect to our fathers, grandfathers, grandmothers, great-grandfathers. That is lacking nowadays in society. So that culture, that attitude has to be spreaded, particularly for the proper reverence to the elderly population. And the proper reverence to the elderly population adds to the not only physical health, but the mental health and the social health. As I told you, the WHO defines health as the complete state of physical, mental and social well-being of an individual. And now more women entering the workforce, this is also a major factor. In many houses, the women are now the working force. That is a necessity nowadays also. Both persons are working. So if your father is already old, 70 years old person, living in your house, and particularly some of my neighbors, they are complaining when they go to visit America, they go to visit Bombay for their sons and daughters. I think both of these spouses, husband and wife, go to their offices concerned, leaving their fathers and mothers alone in the house throughout the entire day, chatting with one another, and ultimately leading the phase of depression, phase of isolation. So this, particularly previously when the women were not in the workforce, at least a woman was there in the house to cater to the psychological and the physical needs of the person concerned, elderly person concerned. But now no woman is there, no man is there, the old person is isolated, his wife is isolated, and both needs the mental and psychiatric help first of all, leading to the physical deterioration. Now, these are the stereotypes. What are the stereotypes? The fighting stereotypes. Here is very important. All of you must pay attention to this slide. It is very, very important. older people, this is one stereotype is that older people are past their sell-by date. People think that if you are 70, your, I think, validity of the check is already lost. You are past their sell-by date, but you must be remembering this. The story says 16 October 2011, when Fauja Singh of United Kingdom, at the age of 100 years, won the marathon. Can you imagine? A person of 100 years, even you dream of living up to 100 years. Anyhow, living up to 100 years is a dream for the Indian mythology, Indian sciences. But going for a marathon at 100 years and winning that marathon, I think it's a great achievement by the Fauja Singh. And do you know this fact? That Fauja Singh started running at the age of 63. When you attain the age of 60, many people keep you a sermon. Now your age is, I think you must relax now. You have done enough what you have done. And if a person of 60 or 65 starts running, you start giving some, you can say, playing mockery of that person. At this old age he is trying to become young. So there is some flaw in it. But Fauja Singh was the person who started running at the age of 63, post-retirement, and won two marathon at the age of 93 and at the age of 100 years. So this shows the grit and determination and attitude that led the person like Swami, like Fauja Singh at the age of 100 years to win that laurels. And I think that's a lesson for all the society, for the elderly people. The second stereotype is that older people are helpless. This you have to fight. Because in 2000 cyclone in Bangladesh, tsunami and earthquake in Japan 2011, you must have read in papers also, you must have seen in the televisions also clippings. Many elderly people in the age group of 80 or 84, they started helping all these Bangladesh and Japan victims. And helping to that an extent that all the population, entire society was feeling obliged to those elderly population. The third stereotype is that older people will eventually become senile. This is not fair. This is not a truth. The older persons means it is not that senility. There are many people that you have become 80 years old, you are senile. So whatever advice and suggestions you are giving, I am not going to take it because it is a senile suggestion. So labeling a older persons with senility is a crime. It is a crime in society. Because the wisdomful experience which a person has attained during the course of their living, I think if we can share that wisdom, if we can share that intelligence, I think this is good for the society. This is highly boon for the society. The older women have less value than younger women. This is also a stereotype. But it has been reputed by 20% of sub-Saharan African women are made carers of grandchildren. It has been found in a recent statistics that 20% of the African women are the carer of the grandchildren. So this stereotype that older women have less value than younger women, it is not true. Women in all age groups are a source of wealth, are a source of creativity, are a source of magnitude. Everything is there. So there is no distinction between young and old regarding that creativity is concerned. Older people does not deserve health care. You have seen that I can't say most of the families. In some of the families I have seen, I being a doctor, practicing physician at Patna, I have seen that if their son gets ill at 16, 17, 18 years of age, a person gets too much concerned and he is ready to go for any expensive investigation for that son who is 30, 32, 25, like that. But if the father at the 85, he falls sick, the person thinks that he is a post-dated, you can say, he is expired. Why I will just spend so much of money on him for which life is not that important. So this wisdom, this thought is a very pernicious thought. It is a cancerous thought in society. It has to be wiped out. It has to be removed. So older people that don't deserve health care is not a good option. Just now I have told you the population aging. Now it is active aging. It is population aging is the reward of medical profession, as I have told you. But active aging is a contribution of an active society, the society which thinks, the society which acts. Because the population aging is a fallout of the scientific world, but this active aging process of optimizing opportunities for health and security to enhance quality of life and the people age. So the quantity of life doesn't matter. I think when you are eating, the concentration sometimes becomes a problem. But I advise you to concentrate more on the thoughts rather than the food. Because it is a good thing that you are taking food. I think it will have help in your concentration also. But I think reference to continuing participation in social, see, mind it. Participation in social, not only medical health, social, economic, cultural, spiritual, and civic affairs, not just the activity of physically active or participating level force. It is not essential that you are going to the office, you are going for a morning walk, you are maintaining your physical health. Physical health has become a secondary nowadays, because I have told you the physical health contributed by us, the medical professional, has led to the population aging. But this, what I am telling you, the participation of elderly in social, economic, cultural, spiritual, and civic affairs. In all affairs of the day-to-day life in society, the elderly people must be compelled to participate. Then the real essence of their wisdom, the real essence of the humanity will come in the picture. The important ingredients are autonomy, independence, quality of life, and healthy life expectancy. Nowadays this term has changed. We are not bothered about only life expectancy, we are bothered about healthy life expectancy. As I told you, it is not only the years that is important, it is the life to the years that is important. And healthy life expectancy means there is disability-free life expectancy. Now this is after active aging. If you have